Orleans relies heavily on tourism and especially the people who provide services for those tourists. That's the hospitality sector. We are joined by David Francis of Verite News and Kevin Ferguson from New Orleans and Company to tell us a little bit about a free health fair for the almost 80,000 people in the hospitality industry. Good morning.
Good morning to you.
Thank y'all so much for being here, and thank you for this health fair that y'all are going to be putting on. Tell me a little bit about it.
So we're really excited. We started this last year, was our inaugural one, and I think what we identified, there's a lot of barriers for folks throughout our community, but particularly in the hospitality industry when it comes to accessing healthcare. It can be transportation, it can be cost, it can be the perception of cost. And so this is really an effort with partners like Verite News, Ochsner, LCMC, 504 Health Net, that all came together to say, hey, let's do something about this. Let's really rally around this idea and provide a great accessible way for people to tap into healthcare and health events. We started this, I think we did it last year in the fall.
In the fall, correct.
And then this year the focus was due during the summer. So this is an event that's open to the entire community, but we focus it on our hospitality workers by hosting it downtown and by having hours throughout the day that are a little bit more approachable and accessible for them.
Well, that's what I was going to ask. Who all can come? Really anyone in the community is welcome, but y'all are just really focusing on providing those extra hours so hospitality workers can make it on their time as well.
Yeah, yes, I mean, it's free to all, but again, like you just said, it's focused on that particular group, but we know we have many people in our community who just don't have the access or the financial resources to afford health care, so we invite everyone to come and join us. There will be probably about 24 healthcare providers who are there, more than 100 healthcare services that will be provided.
What kind of services, you know, if somebody's looking for something specific, with that many people, they might be able to find it.
Oh, key things like diabetes, cervical cancer, breast cancer screenings will be done, prostate cancer. So we're looking for opportunities to help those individuals who may not even be aware of those types of diseases that could cost lives. But we'll also have dental care, we'll have vision care. Last year, just for an example, with the people who came, 2 individuals went directly to the hospital from the screenings. So it's extremely valuable service that we're offering for free to everyone. But like I said, we're focusing on particularly the hospitality industry, but we're not limiting to that.
And that's why you mentioned y'all are going to have EMS on standby as well, because of last year's experience. In case anybody has very acute needs, y'all will be able to help them with that as well.
No,
yes,
absolutely.
Well, it's an incredible thing about that. You know, folks came in, we had over 200 people last year, and the idea that, you know, maybe somebody was on their lunch break or before their shift, came in and got diagnosed with a glucose level that was life-threatening. And then we're referred directly to care. Don't go home, don't go back to work, go get care. So it really emphasizes the importance of this. We were excited about the event. We thought it was a big success. And then when we heard that story, I know for me, it's like, thank God we did this.
Yeah,
you
absolutely.
Really have an appreciation for the need and the scope of what this provides for people.
Absolutely. Why is this so important to your organizations to put this on for the hospitality sector specifically?
Well, you know, for us, we've got a major focus on not just providing support for the businesses in our industry, but also our workforce. So we do a tremendous amount of things to help recruit with job fests. This health fair kind of plugs into that. We also do workforce training, but this is really the backbone of our industry. We had National Travel and Tourism Week a week ago, and we really celebrated our industry. We celebrated our frontline workers, and these are the people that make New Orleans special. When people come here to visit, there is a spirit of hospitality that the people that are on the front line of this industry extend to them that really create the reputation of New Orleans being a special place. And so we have to do our part to make sure we take care of them.
Yeah, and we also look at it from a humanitarian standpoint too, because you think about it, a loss of a parent, of a mother or a father due to an illness that's been undiagnosed puts a great deal of burden on the family and in the children. So for us, we think that to have a vibrant community, you need to have a healthy community. And this is just one of the efforts that we want to undertake to help bring us to that purpose.
Why do you think the hospitality sector specifically needs this? Like, why is there a disparity for those in the hospitality sector?
I think there's a real challenge on a lot of levels. You know, 504 Health Net, who's one of our partners, did a great survey and working group to kind of collect some data around this. And so certainly economics were a part of that. A lot of employers do offer health care, but sometimes you have to pay into it. That's a challenge, right? Transportation, just having the ability to get to appointments or get to a hospital if you don't live close to one was a challenge. And so also the perception, right? That when you look at this list, there's a number of providers, particularly the community health care centers that are part of 504 HealthNet, that provide free or low-cost medical care. So some of it is just letting people know these resources are out there. And those are some of the things we're aiming to correct with this. And it's timing, too. We all work hard. You know, this is a very hard-working industry. One of our industry champions last week was telling me he put 4 of his kids through private school working in our industry, and incredibly proud of that. But when you're focused on your family, taking care of those people, your job, sometimes your own personal health comes late. I'll be the first to admit, we've got a great insurance policy when I work at. I haven't been to my primary care provider in 2 years. So last year at this health fair, I got a bunch of screenings done. I had to talk them into it because I'm below the threshold, but I got the prostate cancer screening done. So it's great. So people are busy. There's a lot of barriers to that.
Sure.
You're taking care of so many people in this industry. We've got to make sure they take care of themselves.
When can people show up if they're hearing this and saying, I need to, you know, I haven't been in a couple years, I need to make time for this. What time can they come out and where is it?
Well, it's at the Fillmore, and also for those who want to park, they'll be parking at the Hilton by the whale lot over there, and there'll be a transportation to it. It's from 10 to 5, I believe.
10 to 5.
10 to 5.
Wednesday, June 12th. At the Fillmore, like David said, it's going to be a great event. There's more information on our website, neworleans.com/community. But we really want to invite the entire community out. We've been working hard to get the word out to our members and businesses in this industry to put it out there, and it's going to be a great event.
Yeah, and I will tell you too, it's Father's Day is that weekend, and I was saying it's a great opportunity for men who normally don't want to go to the doctor to give a gift to their family and have a prostate screening, because that's a leading cause of death for African American males too when you talk about certain cancers.
And it's just a prick in your thumbnail, your finger. It's just a blood test.
Simple.
It's not a big deal. It's just a quick little blood test. David, Kevin, thank y'all so much for joining us this morning. I really appreciate it. And again, that health fair is going to be at the Fillmore, 10 to 5.
June 12th.
June 12th.
June 12th. Thanks so much.
Free to all.
All right.
Thank you.
Well, we are officially in hurricane season now. We'll have all you need to know about generator buying and servicing coming up after the break.
Hurry while there's still time. Get your tickets for the St. Jude Dream Home before they're sold out. Scan the QR code or go to dreamhome.org today. Then tune in to FOX8 Morning Edition on Thursday, June 27th to find out if you're the winner.
Visit dreamhome.org, scan the code, or call the number on your screen. You could win a house. You could save kids' lives.
I was injured when another driver rear-ended my car, so I put the Womack on him, and it got me $300,000.
If you're injured in a wreck, call me, and we'll fight hard to show you why getting big results is no accident.
My name's Eric. I am 39 years old. I've started thinking about getting Botox Cosmetic for the last couple of years. I just see myself on video calls all day, and I really start noticing the lines. I'm still Eric, and I got Botox Cosmetic. I'm seeing a lot less prominent lines than I did before. The results have been subtle but noticeable. Botox